It's a new year, time to quit old habits and develop healthy new ones. Sounds great, right? We're so glad you joined us because today is the day you find the strength and the tools to finally quit smoking for good. But as you've already heard and probably already know, it's easier said than done, especially with a habit as difficult as smoking.
I've been smoking for about 40, 50 years, close to that.
I did start smoking probably when I was in my late teens. I never smoked a lot, but definitely even a little bit is too much.
I started from peer pressure actually, and I'm not going to throw any of my friends under the bus because they were all great friends, and they were like, come on Eli, have a cigarette. And eventually I was like, okay, one couldn't hurt. And here I am, almost 4 years later, one can hurt.
Probably around the age 15, 16 years old. Picked one up and it kind of went from there.
Why is it so hard to quit something that is so dangerous? The answer is not so simple. Access Health Special Correspondent Sonia Velazquez is on location with the story.
Today, I'm meeting with tobacco cessation specialist Rosemary Dunbar from the I Quit program here in South Florida. Why is tobacco so difficult to quit?
There are two parts to tobacco. One is tar, and that's the gooey substance that makes us sick. It gives us cancer, heart disease, stroke, etc. And nicotine is a drug, and it tells us that we feel good.
Nicotine is one of the hardest habits to kick. Nicotine causes the brain to release neurotransmitters that cause a pleasurable effect inside the body. When your body stops getting the nicotine, you lose those pleasurable effects. You become irascible, you have anxiety, you become irritable, you become cranky. It is difficult to function without it. You are addicted to it.
In my eyes, there's not a difference between smoking 10 cigarettes a day and 30 cigarettes a day. You've got to stop.
My wife was really after me to stop, and quite honestly, I've told her so many times that I did stop, but I never really did. And I just got tired of not telling her the truth.
My mom would tell me frequently that she hated that I smoked, and that hurt really bad because I hate disappointing my parents.
I quit because I want to live a better, longer life.
Say you go, you need to go fly somewhere. So you're thinking about, I've got to have like 5 cigarettes before I get on the plane. You know, that's insane.
Christmas is coming up. I don't have to worry about going outside to smoke a cigarette and missing my 7-year-old niece opening her Christmas present that I got her.
Keep some cologne in the car that I would spray myself with so it would cover up the smell.
Coming up, our smokers get a little help from the community and Habitrol. Even with the sobering statistics and the information about the harmful effects of tobacco on the body, 18 out of 100 people in the United States are still smoking. The good news is that there is help available to everyone due to a nationwide effort to reduce the number of tobacco-related diseases and death. Many states right now have funding in place to implement smoking cessation classes that are free for everyone. All you need to do is bring a desire to quit.
We are a state-funded program through the Department of Health, and all of our services are completely free to the citizens of Florida. Yep. We got involved in tobacco cessation actually as part of Florida's the statewide Tobacco-Free Florida initiative through the area health education centers. We do live tobacco cessation classes, small group classes throughout the state in most of the communities in Florida.
So I ended up going to the class, and once I got in there, I realized it was more for myself and my health and the freedom. There's so much freedom when you stop smoking, and I'm saving $150 a month at least.
It was highly suggested that I go to this class, so I figured I'd give it a chance. I went to the class and got serious, and it worked.
The class taught me a lot of ways to handle different side effects, like if I got dehydrated or if I got tired and cranky and hungry. Those would usually be big triggers to start smoking again.
It's a 6-week program, and the first 2 weeks we get people ready. We get them to feel secure and start looking at their behaviors. When do they smoke?
There's as much the addiction of the holding the cigarette as there is to anything else. So by physically still having that alignment of holding something and doing something with your hands, holding celery, holding carrots, instead of smoking, it can help to reduce the cravings.
Once I got in my car, that was a safe place. That's where I would light up my cigarette. That was the hardest part for me, getting in my car and not lighting up a cigarette.
If you find that your trigger is that you like to smoke first thing in the morning, don't smoke first thing in the morning. Get up and go for a walk. Take the dog for a walk. And it's behavior modification.
My two triggers were getting in my car and my little garden, my patio. And so I just decided that those were the two places that I was going to stop smoking.
The best, most important thing to do is really set your date and prepare for your quit date.
You have to be really gentle with yourself. I know I did, and that's what I recommend to people, is just be a little gentle with yourself, because you're going to do it. You are going to do it. When I did the class, they gave me a quit date. Okay, I didn't quit on that date, but I quit exactly 1 week later, and I have not smoked since.
Knowing that I had a time frame and setting a date that was going to be my last cigarette, I was able to live up to that agreement that I made with myself.
I believe it had a lot to do with the preparation ahead of time to get to that point. That it's a decision that I'm able to stick with, and it's going to enhance my life. It's not, I'm not giving anything up. I'm gaining a whole new life expectancy, actually.
Sometimes they think, oh, I have to be ready. I have to really be ready. No, give it a shot. Try. Even if you're just thinking about it, come to the program. We'll work on getting you ready.
The whole point of quitting smoking is to remove the nicotine from your body. So make it a challenge to reduce the number of cigarettes.
When you're removing a drug from your body, any drug, nicotine, you have withdrawal symptoms, and they're unpleasant. By removing the tar, the thing that makes you sick, and just giving you the nicotine, the thing that tells your brain you're okay, you can wean yourself slowly off the drug, and those withdrawal symptoms are much less.
AHEC also provides students with complementary nicotine replacement therapies, such as gum, lozenges, and patches.
What's nice about the class that I attended, it's wonderful. They give you a choice of the lozenger, the gum, and the patch.
Based on the number of cigarettes you smoke, you can check the back of the panel, or you can go to the Habitrol website, www.habitrol.com, and there are resources there to help you quit.
The patch did work for me in combination with lozenges, because you would still get that hand-to-mouth kind of coordination habit, and you need something to quell that. I would usually rely on gum, but when I didn't have enough nicotine in my system, the lozenge was a very smoke-free and effective way to quell that craving.
Using the nicotine patch will help you to reduce the cravings. By having the steady stream of nicotine in your body, you're not craving that. You're not going out of your way to find it. It doesn't stop you from doing the activities that you're doing on a day-to-day basis.
It was a major thing having the patch for the cravings, because I did not have that part of the craving at all anymore. Once I put the patch on, it did what it's supposed to do.
Studies have shown that the use of a support program lead to much higher success rates when you're quitting smoking.
Right now, our success rate is about 35–36% at the 7-month point, which is very good. We're very happy and proud of that number.
It needs to be a partnership. You need some help. You know, you may need some help. I mean, it's how many times do we make a New Year's resolution and then it's gone? You need the help. You need the camaraderie. You need, just to be a part of that. I needed the support. And it's only 6 weeks. Just do it.
It's really important to have a strong support system that you can fall back on, because discipline is really, really difficult, and motivation is fleeting. And when the time comes when your discipline or motivation fails you, you're going to need someone else to help and pick up that slack. And if you have that, it's a lot easier.
A facilitator can only do so much, but when you have your peers cheering each other, literally that's what it is. You listen to one another, you share your stories, what was difficult each week, what was successful. People learn from each other. What worked for one may help another person. And at the end, it's a group celebration.
It's been a A little over 10 months now since I've had a cigarette. So it's good.
I've been smoke-free for 5 weeks. I actually don't really think about smoking very much at all anymore.
I sometimes am shocked that I don't smoke. I don't even want to. It's the freedom. It's the money.
Get the tools you need. Get ready to quit. You too can succeed.
One of the best parts of doing this is hearing from folks that have participated in our programs and have been successful in their quit attempts, in the difference that it's made in their lives, in the quality of their lives, and everything. So that really is, for me anyway, and I think for a lot of people who are involved in this, one of the best parts of all of it, yeah.
Very inspiring. Thank you to our guests for all that you're doing to help people kick the habit for good. Now, if you'd like to try the Habitrol patch, just log on to Habitrol.com. And of course, you can also log on to Access Health right now for more great information. For the millions of people suffering from cancer, the diagnosis is often made worse by a type of severe pain. It's a pain so severe that even the strongest narcotics are no match, and very little help was available until now.
Thinking about when you experience pain, to try and remember it is hard, but at the time that I'm experiencing it, it's the most debilitating feeling in the world. And I start to panic. I can't cope when it starts to happen to me because of the fear of not being able to tolerate it. And that scares me. My name is Gina Adams. And in 2010, I was diagnosed with stage 3 colon cancer. I have 2 daughters, a freshman in college and a senior in college. And I've been married for 23 years to Daniel, my husband.
So when my mom's in pain, it's especially hard for her to even just like leave her bed or go out of her room or do anything but try to feel better. She hasn't been absent, but you know, sometimes she can't attend things. It's hard to leave the house when you think, you know, you might have a pain episode and you're gonna need to plan for that. She's very involved in my life, in my sister's life, but you know, you can tell that it's harder for her to be there in general.
Breakthrough cancer pain affects about 60% of all chronic cancer pain patients. The terminology is self-explanatory. What's more difficult to put into words is just how painful breakthrough cancer pain really is.
The pain would come on very, very suddenly. And I think the biggest thing about the pain was the anxiety that went along with it, because when I was starting to feel the pain episode come on, the anxiety of me not knowing if I was going to be able to get through it was debilitating, and it would add to the whole thing. I would start getting clammy and start getting, you know, just very anxious and wondering how I was going to get through everything.
Joining me now is hematologist-oncologist Dr. Ashish Udrayan. Doctor, welcome to the show.
Thank you.
Why exactly does breakthrough cancer pain happen, and why does it happen for certain patients and not for others?
Breakthrough cancer pain is defined as sudden flare or burst or breakthrough of baseline patient pain that patients experience while taking pain medications.
And why does it happen?
Cancer pain can happen from chemotherapy causes certain types of pain, such as neuropathic or burning pain in your hands and feet. Cancer in and of itself, for example, invading into the bone can cause stabbing, sharp pains in your bones. So that can happen for a multitude of reasons for different types of cancers. Just being on baseline morphine or oxycodone or what have you does not eliminate that possibility.
Doctor, I understand that your experience with breakthrough cancer pain is not just clinical, it's actually personal. Can you tell us a bit about your story?
Sure. My mother was diagnosed with metastatic uterine cancer 4 years ago. The treatment that she received caused neuropathic pain, which is the burning, numbness and tingling pain. She's had progressive bone pain associated with the disease. She would have these episodes of breakthrough cancer pain, which unfortunately just the medicines she was on was not controlling it well.
Right, and the pain is so intense that it actually breaks through some really powerful drugs like morphine and Percocet.
Yes.
Right, and this must leave your patients feeling so hopeless. Do they even go as far as to open up to their oncologist when this happens to them?
Patients sometimes don't want to divulge symptoms or side effects to
Why
their
wouldn't
doctors.
they?
Because they don't want the cancer treatment to stop. You know, they're afraid that if they inform their doctor of too many side effects, that the treatment that may be working for their cancer may be stopped because of side effects. And to others, they feel that it's just a way of life.
Right.
That it comes with the whole package of having cancer, that this is how they have to survive, which is not true.
There is good news. You are here to spread awareness and give patients some information about a treatment that they might not know about.
It's true. There's a class of drugs called transmucosal immediate release fentanyl, or TIRF. This class of drugs can help eliminate breakthrough cancer pain a lot faster than what immediate release morphine can. They take as long as 45 minutes for them to take effect to work. So what's happening in that time is patients already had their sudden onset of debilitating breakthrough pain, and which may be over, that episode may be over before these other products have even a chance to work in their bodies. And the good thing about TIRFs is that the relief of pain can occur as early as 5 minutes.
And that's a big deal when you're at your child's soccer game, or whether you're shopping, or when you're at work. You can't wait 40 minutes when you're feeling the pain at that moment.
Your quality of life, as well as your what we call performance status, gets affected. Why that's more relevant also in patients is because what us as cancer doctors use is a performance status to see whether or not patients can tolerate their cancer treatment. So if the patients become too debilitated, they cannot receive their cancer care.
Are we saying that these drugs are more powerful than morphine?
Fentanyl is about 100 times more potent than morphine. This is a reason why the patients who qualify to receive this medication need to be what we call opioid tolerant for them to tolerate this fentanyl.
And does it come in form of pills?
It comes in multiple different forms. It comes as what we call a buccal tablet, or the tablet that you put inside of your mouth. It comes as a buccal film, a lollipop, as well as a spray that you put under your tongue.
So, doctor, how significant is this breakthrough cancer pain treatment for those patients that are suffering largely in silence?
You know, Eric, it's very important because cancer has a very negative connotation in our society about it being a death sentence. And it's truly not the case, because it's truly becoming what we call a chronic disease. And because it's becoming a chronic disease, we have to deal with the symptoms associated with the disease and/or the consequences from the treatments of the disease. And I tell my patients, you know, there is an option. I want my patients to live rather than to exist.
Right.
And with this drug class, we can truly get our patients to living their life again rather than have to suffer.
I hear you. So they're living, they're present, and they're not living in fear. Thank you so much for bringing all of that awareness. I also want you viewers out there to hear how Gina's whole outlook changed after receiving this treatment.
Yesterday, I started to feel like there was an episode coming on, so I went to sit in the bathtub so I could relax, so I could calm myself down. And so I called my older daughter and I said, go get me my medicine and set it in the bathroom so that I know that it's there. And just it being sitting there, I was able to, you know, it just made me feel more confident, like I was going to get through the situation. Now I can enjoy my family more. I can return to my normal life. And I can only spend a little bit of time on cancer and pain instead of a lot of time.
We have a lot more quality time together now that she can feel better. That makes me happy.
And again, if you are experiencing breakthrough cancer pain, don't suffer in silence. Talk to your oncologist. There's also a free book, Compliments of Insys Therapeutics. It's a great resource for both cancer patients and caregivers. All you do is register at breakthroughcancerpain.com to get it. And of course, you can also log on to accesshealth.tv for more information. According to Forbes magazine, only 8% of Americans actually achieve the goals they set on January 1st. But just because we fail doesn't mean we don't try. About 40% of Americans make New Year's resolutions. And just to put that into perspective, about 1/3 of all Americans tune in to watch the Super Bowl. Experts say those who do achieve their New Year's resolutions set smaller, more realistic goals. Successful goal setters also stick to specific targets, not a vague one. So for instance, instead of saying you want to start working out, commit to a weekly kickboxing or yoga class. And finally, if you've already failed at your New Year's resolution, don't worry, you still have 11 more months to succeed.